Names are Marley, Alex, and Ashley, and we are OT students at American International College. Today we will use CINAHL as a database to answer the following question. What is the effectiveness of constraint-induced movement therapy on improving upper extremity function in patients recovering from stroke compared to individuals who did not receive CIMT? There are 5 levels of evidence, with level 1 being the highest credible standard. Examples of this level include systematic reviews, randomized control trials, and evidence-based clinical guidelines.
Okay, so to answer our research question, we'll be using the research database called CINAHL. And this is the homepage of CINAHL right here. And at the top, you're going to type in your keywords for your research. So in this case, we'll be using CIMT and stroke. And we can hit search. And then here you can see all of the research articles that come up from our search. And over here, if you'd like to filter out, you can limit your research articles to the type. So you can either click link to full text, references available, or if you'd like to just see the abstracts, you can do that. You can filter the publication dates here, changing the date that you want articles from, and you can see that it changed it already. And then down here you can also change the source type, so you can either click all results, you can click just academic journals if that's all you'd like access to, etc. So as you can see at the top here, we've already done our filtered and I've chosen 4 different research articles that will help us answer a question. And the first one we're going to review is a systematic review. It is called Modified Constraint-Induced Movement Therapy for Upper Extremity Recovery Post-Stroke. What is the evidence?
So the evidence supports that this results indicated that participants receiving CIMT experienced movements or improvements in upper extremity impairment and activity level. We can conclude that CIMT is an effective intervention for upper extremity recovering from post-stroke.
So we know that this is a strong research piece to use because it is a level 1 and a systematic review. The second article we have chosen to answer a research question is yet another systematic review called Constraint-Induced Movement Therapy Compared to Dose-Match Interventions for Upper Limb Dysfunction in Adult Survivors of Stroke, a systematic review with meta-analysis.
And this supported that CIMT produced greater improvements in a variety of indicators for upper extremity function in adult survivors of a stroke with residual movement of upper limb.
The third article that we have chosen to answer our research question is a comparison study. It's called Comparison of Constraint-Induced Movement Therapy and Bilateral Treatment of Equal Intensity in People with Chronic Upper Extremity Dysfunction after CVA.
This randomized control trial showed significant improvements were found in both WFMFT and COPM scores across time in both control and experimental groups. We can conclude that CIMT is effective in improving upper extremity function in CVA.
So this is another strong piece of evidence to use in answering our research question because it is a randomized control trial and it's considered a level 2 piece of evidence. And the last article we have chosen is a case study, which is considered a level 4, not as strong as systematic reviews or randomized control trials, however, still considered an evidence-based piece of research.
In this piece of research demonstrated after 2 weeks of CIMT, the patient demonstrated improved measures in pinch and grip strength. The greatest improvements were seen 6 weeks following CIMT intervention.
Based on these findings of these research articles, we can conclude that CIMT is an effective intervention to use on patients with upper extremity impairment due to stroke compared to individuals who did not receive this type of therapy. Thank you, and we hope this demonstration assists you in strengthening your research